Welcome everyone to Diabetes Canada's 2017 webinar series. My name is Farah Ismail and I will be your host for today. We're delighted that you're able to join us today on a webinar to learn about living well with diabetes, a South Asian perspective. Now to start us off, I'd like to draw your attention to our survey, and that's located at the top right-hand section of your screen. In order to better serve your needs, we kindly ask that you provide us with your input by completing the short survey towards the end of our presentation. And we thank you in advance for your input. Throughout today's presentation, you will have the opportunity to ask questions, and this can be done by simply typing in the question and answer box, which is located at the bottom right-hand section of your screen. And we will be happy to answer them towards the end of the presentation. We will be displaying a few polling questions at the beginning of our presentation today and would love for your participation. I would like to note that your answers to the questions will remain completely anonymous. Also note that you're able to customize your screens. You can expand or collapse them as you see fit, and that can be done by simply dragging down the bottom right-hand corner of each of our webinar pods. Our presentation today will be about 45 minutes in length, and we'll have another 10 to 15 minutes at the end for questions. I would like everyone to know also that our presentation today is recorded and will be made available on the Diabetes Canada website in the coming weeks. Now to start us off, I'd like to start off with our first polling question. So if everyone can let us know, how are you affected by diabetes? And please select all of the options that apply and then click Submit. And I'll give everyone just a couple seconds to fill that out. Okay. Oh, and it looks like we have some folks that are living with type 2, as well as some that are healthcare professionals and other folks that are just interested in diabetes-related information. So thank you everyone for filling out that question, and welcome everybody once again. And I'll take us here to our next question. How are you participating today? As an individual, in a group of 2 to 5, or in a group of 6 or more? And again, I'll give everyone just a couple seconds to fill that out and click Submit. Great, and it looks like most of you are participating as an individual, and some of you are in a larger group. So thanks so much again for filling those out. And now I'd like to welcome our speaker, Dr. Ali Prepthani, and thank him for joining us today. But before I turn it over to Dr. Prepthani, I'd like to give you a brief introduction. Dr. Ali Prepthani is an internist and endocrinologist at McMaster University and been recently promoted to full professor of medicine with the Division of Endocrinology and Metabolism, Department of Medicine. He is the founder and director of both the McMaster University Internal Medicine Global Health Program and the Endocrinology and Metabolism Residency Training Program. Dr. Prepthani is currently on the Expert Committee for Diabetes Canada Clinical Practice Guidelines and on the task force for the tools implementation for the Canadian Hypertension Education Program, and also sits as the chair of Endocrine Hypertension Subgroup on the CPG's Task Force for Hypertension Canada. He is also a consultant for the South Asian Diabetes Chapter of Diabetes Canada. Dr. Prepthani is actively involved in voluntary work both in the community and academically. He has won the Ontario Voluntary Service Award by the Government of Ontario for years of community service. Dr. Prepthani is also providing voluntary medical service to the Aboriginal and First Nations community in Hamilton and Brantford, Ontario. For more information on Dr. Prepthani, please read the speaker bio section, which is located to the left of your screen. So without further ado, I present to you Dr. Ali Prepthani.
Thank you, Farah. I hope everyone can hear me. I guess I can just advance the slides, right, Farah?
Yes, absolutely.
I wanted to really thank Farah for inviting me to speak today. It's always a pleasure to speak to non-physicians. It's actually more challenging than you would think, but hopefully I'll be able to share some information and allow time for questions and answers. And remember, when you ask a question, you're never wrong. It's never wrong. There's never a wrong answer. It's just we can always make an answer right and learn from each other, okay? So I really don't have any conflicts of interest with this presentation. I'm not getting paid to do this. At least that's what Farah has told me, and so there's no conflict. And I'll just start with the next slide. So we're going to focus mainly on type 2 diabetes mellitus because this is a type of diabetes that affects most of the South Asian community. I'll briefly speak about type 1 diabetes in a bit, but that's actually not as big a problem in our community, in the South Asian community, as it is with type 2 diabetes mellitus. When you think of diabetes mellitus, basically there's two main issues, but all of it results in high blood sugar or high blood glucose in the blood, which results in many, many concerns and complications, which I'll speak about briefly. But this results as a result of two problems. Either there's too little insulin that is being produced from the pancreas, which is a very important organ in your tummy, or you're producing enough or even lots of insulin, but it's not working properly or being used properly at many, many sites in the body, including the muscle, the liver, and the fat. And there are many, many organs now that we've discovered which are very important in controlling your blood glucose. So it's just not the pancreas and the muscle and the liver. The kidneys are also very important. The digestive system or the gut is very important, including the fat tissue and so on. So we've learned a lot about diabetes recently, and that's why by knowing this information, we are able to develop new medications which are safe and effective for improving your glucose levels and hopefully preventing complications. So how common is diabetes? Well, we don't have very, very recent data, but there is reasonably recent data showing that if you look at everyone in Canada right now, about 1 in 20 people, if you look at all age groups, have diabetes mellitus. But if you look at the South Asian community, it's actually much higher. It's probably actually 1 in 10 or even more with more recent data. So it's actually twice as common in the South Asian community compared to the non-South Asian community. And there are many reasons for this, which I'll go into in just a bit. And I've just shown a little bit of a map. When we talk about South Asians, it's just not about India or Pakistan. It includes many other areas such as Nepal, Bhutan, Bangladesh, Sri Lanka, the Maldives, and so on. And this is a serious problem because diabetes mellitus is actually increasing across the country right now in both the South Asian and the non-South Asian community. This is just a nice map of the world, and the reason I'm putting this up is just to show a point is that if you look back many, many years ago, and you look at now, all across the world, not just Canada, not just India, diabetes mellitus is increasing. And if you go to 2025, which we haven't reached yet, the projected rates of diabetes are increasing significantly. So this is a condition that is not going away, and we have to take this very seriously because it is costing the system millions and millions and billions of dollars and bad health outcomes. So although this is a projected outcomes, I think we can do a lot right now to actually make this map look much better because we do have some control over the future, and that's our job right now. So again, if you look at all types of diabetes in all Canadians, about 90% is type 2, and about 5 to 10% is type 1, and the rest is other types. But in fact, if you look at the type 2 population in South Asians, it's actually probably even more than 90%. In fact, I was just talking to one of my colleagues in India a few days ago when I was in a meeting in Orlando, and they're thinking that the risk of type 2 diabetes compared to type 1 is actually probably 95 or 96% of type 2 and only about 4 to 5% of type 1. So it's much more common to have type 2 in South Asians than in non-South Asians. And most of these patients actually are overweight or obese, and only about 10% are lean. The interesting thing is don't be fooled by the South Asian who looks lean because it's the waist circumference, the apple-type body, which leads to increased risk of these metabolic problems such as diabetes type 2, high blood pressure, bad cholesterol, and things like that. So even having a normal weight in a South Asian can be very, very falsely reassuring. It's the waist size, the waist circumference, which is very, very important. And why is type 2 diabetes more common in South Asians? Well, many, many things. It's because we've become more urbanized, coming from a non-urbanized center. We've gained weight, the fact that many people are sedentary and not very active, and a lot of it's actually genetics. Genetics is there, but you can protect yourself from developing type 2 diabetes if you maintain a high activity, eat well. But once you start becoming very sedentary and your diet changes, that's when you can get type 2 diabetes mellitus. So it's all about urbanization. So if you can sort of minimize urbanization, you can protect yourself from many of these conditions such as type 2 diabetes and high blood pressure and so on. So what are the complications of diabetes mellitus? They're very similar although not completely, between type 1 and type 2. But for type 2, there are many, many complications. We can look at large blood vessel complications in the long term and small blood vessel complications. On the right, these are the small blood vessel complications, including diabetes, eye disease. The number one cause of blindness in the world is now becoming diabetes. The number one cause of kidney disease is diabetes, kidney or renal disease. There's also other conditions you can get. You can damage to your nerves. You can get a lot of pain. And in fact, you can step on something and can't feel anything and get a very bad infection, and that's also one of the number one cause of amputation. On the left, we're looking at the large blood vessels. A very common complication of diabetes is also stroke, which can be debilitating. Foot problems, poor circulation in the legs. But at the end of the day, the most concerning complication, as you can see flashing nicely there in red, is heart disease. If you have diabetes, compared to people who don't have diabetes, the risk of high blood pressure and heart disease is 2 to 4 times the other population. So very, very high risk of having heart disease if you have diabetes compared to someone who doesn't have diabetes. And the good news is, I'm going to keep on saying this, is we can prevent many, many of these things with simple, effective therapy in our population with simple things. That's the good news. So this is a nice picture. I like to show pictures because this is someone who had diabetes for a long time. The sugars were always high, and the patient was walking barefoot, but there was a complication because the patient couldn't feel anything on their feet because of something called diabetic neuropathy or nerve damage. They couldn't feel anything, and this is what happened. They didn't look at their feet. They eventually ended up getting an infection, and it required an amputation. The foot had to be cut off. So this could be totally preventable by good sugar control and by just doing good foot care, by looking at the foot and the feet regularly and not walking on bare feet. So this, again, can be prevented. This is when your eye doctor, either an optometrist or an ophthalmologist, looks at the back of your eye with that machine. And this is the only part of the body where you can see the large blood vessels called the arteries. And this patient here has many, many complications of diabetes. As you can see, the yellow stuff is a little bit of leakage of protein, and the red stuff in the middle is actually hemorrhaging. Normal eyes, or the retina, this is the retina, the back of the eye, should not have these. It should be quite clean by seeing nice blood vessels. Again, preventable by good sugar control and by seeing an eye doctor regularly and good blood pressure control. This is someone with diabetes and heart disease. As you can see, the arrows showing that there's narrowing of the arteries. And if this completely narrows, you get a heart attack. If there's partial narrowing, you get something called angina, or you get chest discomfort and difficulty breathing. This is, again, preventable. The most important thing is actually not to smoke, control your blood pressure, and control your cholesterol with certain medications. But even diabetes, if it's not well controlled, can lead to rapid or quick narrowing of the artery, which can be disastrous and is the number one cause of death in patients with diabetes, in particular type 2 diabetes. So this is again showing the concept I talked about earlier. If you look at this graph, on the bottom you have time, and on the side, on the left side, you have how common it is. So as you look at time, if you look at people who live in a rural area, which is at the bottom line, is the risk of heart disease actually is still quite low. But as the time has progressed, in the urban centers, you can see there's a significant exponential increase in heart disease. And this is even more common or more prominent if you have type 2 diabetes mellitus. So this is just showing with time we become more urbanized and have had more heart disease and the risk of diabetes causing all these problems. So now we're going to go over to something called the ABCs of diabetes, something easy to remember so we can take these things away, not only to people who have diabetes, but to your families, because diabetes is a family condition. We live together with it, and we have to help each other with it. In addition to your healthcare providers, such as your doctors, your nurses, your dietitians, your pharmacists, social workers, there are very many people who are involved with diabetes management and help. So what's the A for? A is for something called the A1C, the hemoglobin A1C. The A1C is a blood test done by your doctor, which measures the overall control of your sugar levels over 3 months' time. And in most people, your A1C, you can ask your doctor, they'll give you the number. It should be less than 7% for most. Not for all, but for most. Some people who are older, who you don't want to be too tight with glucose control, will allow it to be a little bit higher. But I would say for the most healthy people, it should be less than 7% so we can prevent complications of eye disease, kidney disease, nerve disease, and in some even heart disease. How do we do this? Again, lifestyle is very important. Diet I'm going to speak about in a bit, exercise, maintaining your weight, and there are some very good medications, and insulin. Insulin is very safe. If you need insulin, it's a good idea to take it. It's very safe, effective, and it works well with other medications and lifestyle also. That's A. So B is also very important. So diabetes is just not about sugar. Blood pressure is very, very important. Most people with type 2 diabetes also have high blood pressure, so it's important to control high blood pressure. And in most patients with diabetes, the blood pressure control should be less than 130/80. If you do have high blood pressure, it's actually worthwhile to buy a blood pressure monitor. They're very cheap. They're about $50 to $60, and make sure it's not a wrist one. Wrist ones are not accurate. Make sure it says Hypertension Canada endorsed. And you can use this and go onto a good site and actually monitor your blood pressures and take them into the doctor's office to make sure your blood pressure is well controlled or not, and you can have adjustment of your medication and lifestyle to improve blood pressure control. The most important reason to control blood pressure is to improve the risk of stroke, which can be quite debilitating. I put that in red: stroke, stroke, stroke. But also by controlling blood pressure, you can reduce kidney disease and heart disease. As I said, what's important? Lifestyle. And there's a nice website, easy, hypertension.ca. There's a very, very helpful information both for patients, the public, and healthcare professionals. Free of charge, lots of nice stuff that's downloadable and readable. And again, try to minimize your salt intake. People think salt comes from just a salt shaker. This is a myth. Most of the salt comes from breads. And in our South Asian community, we all have lots of bread. The chapati, the roti, the paratha, all our curries. So really, really try to minimize salt. Another big salt problem is fast foods and processed foods. So it's better to eat lots of fruits and vegetables and low-fat dairy, which have low amounts of fat. Bread has a lot, sodium or salt. Low-fat, low-sodium bread can only be made at home. So when you look at labels in the store, look at the DV, the percent daily value, and it should be less than 5% of sodium, which is probably the most amount of sodium you should be getting in terms of DV. Obviously, medications are very important because alone lifestyle often doesn't help. You need to work it together, and they're very safe together, and it can prevent stroke. And meditations can help also. So these are simple, non-expensive things that can help with not only with blood pressure, but overall energy and psychological state and so on. And I think a lot of our communities and a lot of our cultural connections do endorse meditation, regardless of what faith or other culture you may follow in our South Asian community. C is for cigarette smoking. If there's one thing you can do or not to do is stop smoking. And again, obviously, I'm not going to ask who smokes or not, but this is a personal thing. But there's no such thing as one cigarette is a little. 0 cigarettes is the goal in the long term. I know it's very difficult, but there's lots of help right now with therapy with your doctors and also good medications that can help you stop smoking. And this is very important for the whole family. It can save money, and it can prevent heart attacks, prevent lung cancer. It's very important. Stopping smoking is actually critical. Difficult, but with help, it can be possible. Okay, and as I've said, it can prevent lots of cancers. And I put down increased bank account because you can put more money in your bank, so you can do other things with all the money you save from cigarettes. D is for diet. Now, Canada has a healthy food guide. We have to modify the Canada guide to the South Asian community, and there are modified guidelines even because Canada recognizes we're a very multicultural community. So it's okay to eat all our foods. We have to modify it. So the most important thing is lots of vegetables, lots of fruits, fish, lentils, low-fat dairy. And this can be adapted to people who eat veg and non-veg because we have to respect people's cultures. The important other things are small portions. The problem with the South Asian community is big portions late at night. Let's do the opposite. Small portions multiple times during the day. Biggest meal should be breakfast. People who skip breakfast tend to gain a lot of weight and they don't function well at school or work. And this has been shown in lots of studies. And if we're going to use oil, I'm not saying use a lot of oil, but the preferential oil is canola oil, which is a monounsaturated fat, unlike things like ghee and butter, which have a lot of fat. So smaller portions are important in a South Asian friendly diet. So instead of having fried samosas, modify that, have baked samosas. Instead of having paratha, 3 of them, have 1 of them. So it's all about modification. We can eat all of our foods, which are very, very tasty, but in modification, culturally sensitive manner. And there are South Asian dietitians who are available to guide you to see exactly where they can make changes and help you in a South Asian friendly manner. And again, it's a family matter. So we got to start early, even with our children. E, it's for exercise. You don't have to join a gym. This should be a family thing. Probably the best exercise for most people in this day and age because of our health, our lifestyles, is walk a lot at work. If you have stairs, use the stairs rather than taking an elevator. If you work in a mall, take, again, the stairs rather than an escalator. But walking is the best thing. The important thing is it's got to be done regularly, and then you have to have fun, and it's got to be at least 20 to 30 minutes a day, and make it a family thing. But if you want to join a gym, that's fine. I like to play sports, so I do that, but anything that you do regularly and it's fun and doesn't cost too much money, that's the important thing, and make it a family thing. And you can do this in the mall and in the park. The problem with our beautiful country, Canada, despite being a great country, is the weather always doesn't allow us to do things that we can do in other countries like India and Africa because of the warm weather over there. So often we have to go to a community center, but the mall is a great place. As long as you're not spending all your time in Tim Hortons, walking is very good in a mall because often they're big and you can do lots of walking and up and down the stairs and you can meet people there. It can be quite a social thing too, which is important for our seniors who often can get depressed with the weather that you can have at times in the northern hemisphere, such as Europe, the United States, and Canada. F is for fat or cholesterol. The bad cholesterol is LDL. Your doctor will tell you this, and the goal is to have it less than 2.0. By cutting it back to less than 2.0 with medications, you can significantly reduce the risk of stroke, but more importantly, significantly reduce the risk of heart disease and heart attack. But it's got to be done with a medication called a statin. Rosuvastatin, atorvastatin, simvastatin, these are proven to be very safe and effective for getting the LDL cholesterol less than 2 and preventing heart disease significantly, along with diet and exercise. So with diabetes, even if your cholesterol is normal, there is now evidence to say you should probably still be on a statin if your doctor thinks so, because it can further reduce your risk of having a heart attack in a very safe manner. The G, so there's lots of good news. And I've talked about a lot of good news so far about preventing complications. So again, like some conditions, we can do a lot for diabetes because it's all about preventing complications and leading a healthy life. A little bit about medications. There's many medications available right now, and they're all depending on the type of patient profile. So your doctor will make the decision after talking to you. It's a combined decision. What's best for the patient? Can they afford it? Where's the problem with the sugar? What's the risk of complications, and so on. But generally speaking, they work in many, many ways depending on the medication. Some of them increase insulin production from the pancreas. Some of them, the newer ones, actually get rid of glucose in the urine. Those are the new drugs called the SGLT2 inhibitors, things like Invokana, Forxiga, and Jardiance. There's also some medications that help the muscle take sugar up better or glucose up better, and the liver take glucose up better, such as metformin. And some of the ones who can make you get full faster, like the DPP4 inhibitors, and slow down emptying of the stomach like the GLP-1 analogs. There are some medications we use sometimes also called acarbose, which prevent the breakdown of complex sugars to so there's less absorption in the blood. So again, this is a little bit complicated, but just remember the point here is we have lots of new medications that work in many different ways that can help improve your sugars, and even some of them can prevent heart attack. Really new and important. So I've just listed some medications. Metformin probably should be the first one for most people, as long as there's no reason for not to be on it, and then your doctor can make that decision. But as you can see, the rest of them, there's lots of them. I wanted to point out the new ones called the SGLT2 inhibitors. These actually have been shown to be very safe. They're new, and in some people, they can even prevent heart attacks. These are new and very effective, and they're often used in combination with metformin. But at the end of the day, you made an insulin also. The important thing also is you have to combine these with diet and exercise for them to work best. It can't be just a medication. You've got to work them together so you get the most benefit. Insulin. Many people get very scared about insulin. But often when people start insulin, actually they feel much better because their sugars go down. And you can really minimize the risk of low blood sugars by checking regularly and eating regularly and not taking too much insulin. So this is not that big an issue if you're educated well about it. And we have many, many people who do this with you. Not only the doctor, the nurses and the dietitians and the pharmacists are very, very important. It's not painful to take insulin. And often you'll get very good control. Some people need 1 injection a day. Some people need 4. It depends on the patient. And this can be a discussion you can have with your healthcare provider. There's many new insulins that are very safe, effective, and cause very low risk of low blood sugar, also known as hypoglycemia. Or I just, what happened there? It got minimized for some reason. Are you able to maximize it for me? Sorry about that. I'm just trying to see what happened there. Oh, there we go. Sorry about that. Okay, I'm just gonna. What happened there though? How come I can't advance this far? Oh, there we go. Okay, sorry about that. I got it. Okay. Apologize. So the next slide after insulin is we know that by controlling your sugars, we can significantly decrease the risk of small blood vessel complications. If you look at this graph, the blue line is when you control your glucose levels quite well, and the red line is when you don't control them as well. As you can see, the better the control with the blue, you have less complications with respect to percentage on the left, okay? So the message here is the better the control of sugars, the less the complications, especially kidney disease, eye disease, and nerve damage. And that's why the goal should be less than 7% of A1C, which is on the bottom left. And before meals, for most people, between 4 and 7, and 2 hours after meals, for most people, between 5 and 10, and even in some, between 5 and 8. So we've talked about diabetes, we've talked about some of the complications, how to prevent complications, how to treat diabetes and some of the medications. So let's say you don't have diabetes. What's your risk of getting diabetes? So these are all the risk factors in terms of getting diabetes. And remember, you can prevent diabetes by doing some things which I'll talk about in a bit. But if you have a close family member with diabetes, your risk is higher. If you're over the age of 40, if you're overweight, if you've had diabetes during pregnancy or even delivering a large baby, if you're inactive, and in particular if you're South Asian. Other risk factors, other ethnic groups that are at risk also include the Hispanics and the Aboriginals or the First Nations. Also, if you have a risk, if you have heart disease or high blood pressure or high cholesterol, you're also at risk. And there's also independent risk associated with the condition called schizophrenia, which is a psychiatric condition. So what this is showing is about weight. When both men and women, as their weight goes higher and you go to the right, the risk of diabetes actually increases significantly. More likely in women, actually. So women who are the same weight, who have the same BMI or body mass index as the men, they have a higher risk. So it's even more important for women to work on weight, perhaps to decrease the risk of diabetes or preventing diabetes. What is pre-diabetes? So these are people who don't have diabetes, but they have pre-diabetes, or we call impaired fasting glucose or impaired glucose tolerance. So these patients are at very high risk of developing diabetes, the ones who have pre-diabetes. They have lots of insulin hanging out, but it's not working, and slowly the insulin production is getting lower and lower from their pancreas. So initially they're normal on the left, then they get impaired glucose tolerance, and their pancreas doesn't work well, and eventually they'll get type 2 diabetes because the pancreas is not working well, and the insulin that they're producing is not being taken up properly by the muscle and the liver. So the middle part is the pre-diabetes, and the right is the type 2 diabetes. So this is again showing that people who have a pre-diabetes, so if they have both impaired fasting glucose, now I'll define impaired fasting glucose. Impaired fasting glucose is when your sugar in the morning is between 6 to 7. Impaired glucose tolerance, IGT, is when you drink this sugar drink at the lab, 75 grams of glucose, and your sugar 2 hours after that drink is between 7.8 to 11.1. The top left, if you have both, your risk is very high. If you just have impaired fasting glucose, the risk is lower. If you have impaired glucose tolerance, it is intermediate. And NGT is normal glucose, normal fasting glucose, and normal glucose tolerance, where your risk is very, very low. So this is, again, the definition of prediabetes. And the more the risk factors you have in terms of sugar being high after meals or in the morning, your risk is higher of getting type 2 diabetes mellitus. So how can you prevent diabetes? Probably the most important way of preventing diabetes, unfortunately, you can't change your genetics, but probably the most important way to prevent diabetes is a good lifestyle. Lots of walking, a healthy diet. The diet for a patient with diabetes and someone who has pre-diabetes is exactly the same. So lots of vegetables, low-fat dairy, fruits in moderation, fish, and vegetables, okay? So these are the most effective therapies. But sometimes your doctor may prescribe a medication, and the one that's been easy to use and studied is metformin, even for the prevention of diabetes, in addition to treatment of diabetes. There's other drugs, such as rosiglitazone and pioglitazone, but due to other side effects, they're not recommended right now to prevent diabetes, although they're very effective. And acarbose is often not tolerated on the top left, so that's not often recommended either. So again, if you look at this slide, as you can see, on the left, in the middle, is if you do nothing, you're really not going to really change your risk of preventing diabetes. If you do diet and exercise, you'll cut back your risk from 17.3% on the left to 4.2%. And that's why I mentioned a good lifestyle is the most effective therapy for preventing you going from pre-diabetes to diabetes. Metformin goes down from 11.3 to 6.9% in terms of reducing diabetes. Rosiglitazone is very effective also, but we don't use it for reasons I mentioned, and acarbose is somewhat effective too. So again, the most important way to prevent diabetes is a good diabetes and exercise if you have pre-diabetes. The goal is to lose about 5 to 7% of your body weight. Even a little bit of body weight loss is very effective. You don't have to lose hundreds of pounds. Even 5 to 7% of your body weight is very beneficial. And it not only will it help with your blood sugars, but it will also help with your blood sugars, your cholesterol, even your arthritis, maybe your sleep apnea, many, many benefits. Your psychological state, you just feel better because your clothes will fit better and so on. And this includes both a good diet, as I've talked about earlier, in a South Asian friendly manner, and being active for about at least 150 minutes a week, something that's fun and sustainable and consistent. Can we cure diabetes? Well, there is some data that if you have diabetes, something called bariatric surgery or weight loss surgery in the right patient can actually put diabetes into remission. But again, this is something that can be decided by not only your doctor, but a multidisciplinary team where there's a dietitian, there's a social worker. So if you're the right candidate, or if you're interested, this is something you can speak to your doctor about if you're a candidate for something called bariatric surgery, because it can be quite effective in the right patient at the right time. So why should we do all this? Again, the good news. You're going to feel better and have a better quality of life. You're going to prevent heart disease and stroke disease by taking simple medications and controlling blood pressure, cholesterol, smoking, and certain drugs. Aspirin I put in a very tiny font, and that was purposeful because if you don't have heart disease, the benefit of aspirin is very low. So an aspirin a day does not keep the doctor away unless you have heart disease already. So everyone should not be on aspirin because it can be dangerous. It can cause bleeding also. But in someone who has heart disease, the benefit is higher than the risk, okay? So not for everyone. It can decrease eye damage, decrease kidney damage, and prevent dialysis, prevent amputations, decrease hospital admissions, and prevent early death. And overall, enjoy a good quality of life. So the bottom line, type 2 diabetes is very common in South Asians especially. It has a major impact on our health and is very expensive to our system. And there's lots you can do about it. I've already talked about the ABCDEs. A for A1C, B for blood pressure, C for cigarette cessation, D for diet, E for exercise, F for fat, and G for good news. And remember, you should get screened for diabetes because you may not have symptoms. And the earlier you pick it up, there may be benefit of preventing complications. This is done not only with medications, which are very safe, but you also need diet and exercise and a small amount of weight loss to really help you control your diabetes. And all this stuff can prevent complications, in particular heart disease, which is the most serious. But the other ones are also very important. And remember, if you don't have diabetes, get tested if you have any risk factors, such as a family history, obesity, large baby, pregnancy and diabetes, and so on, or if you have symptoms of diabetes. So there's a couple of things I wanted to end off with, which are very important quotes that I always put up, and I take them quite strongly. Remember, you are in control of your diabetes. Be happy. Enjoy your life. And we all have difficulty with this quote here. Take a little time to do it right now, or take a lot of time to do it later. This is so important. So procrastination doesn't help everyone. And I know we've all done this, but remember, do it right now in small amounts, and you can prevent lots of issues in the future. A couple other quotes. Education is the most powerful weapon which you can use to change the world. Nelson Mandela, so true. And an investment in knowledge pays the best interest. Benjamin Franklin. And this is what all of you are doing today because you're empowering yourself and your families. And I thank you for doing this because if you can even change one life, that will hopefully impact many, many other lives in simple ways. I also I'm the consultant for the Diabetes South Asian chapter, and there's a nice website. We have events, and we want to do this promote diabetes awareness in a very culturally sensitive manner. And it's a pleasure to be part of this organization, which is headed by our leader, Siva Swaminathan, who has a strong passion for diabetes also. And we'd be happy to have you join us in our sessions and our chapter meetings, which are completely free, and we do it in different areas of GTA and outside of GTA, which are very informative and very easygoing. And we often have healthy food there too for you. So that's all I have to say, and I really wanted to thank the audience for participating today, and in particular Farah Ismail, who led this and invited me to do this, and I wanted to thank her for the opportunity to do this, and my family, who's always been supportive in my endeavors and my passion for diabetes and promotion and awareness of diabetes. Thank you very much to all of you.
Thank you so much, Dr. Praptani. You've provided us with some amazing insight on a perspective from diabetes from the South Asian lens. And just want to thank you very much for your great presentation today. We will take a few questions from the audience, if that's okay with you.
Absolutely.
Great. So I'll start with our first question here. So one of our participants has asked, after I exercise, I notice that my blood glucose levels fall into a good range. However, about 1 to 2 hours after exercise, my levels increase, and I have not eaten anything. Why does this happen?
That's actually a very good question. So sometimes it can happen in some people that when you exercise too much unexpectedly, you can release certain other hormones too that actually initially can lower sugars because you're using the sugars. Then after a while, because your hormones go very high, like the catecholamines or the epinephrine, the adrenaline, that can actually raise your blood sugars. So how do you then how do you deal with that? So if you have a consistent pattern, one way of doing that maybe is actually you might need to, if you're on insulin, maybe taking a little bit of insulin shortly after, so you can reduce those sugars. If it's unexpected, obviously you have to check quite frequently, and sometimes what you can do is even having a little protein snack which doesn't have the surge in sugars can also help with that, rather than taking a pure sugary type ingestion of food. But often this is unpredictable. It can be challenging, but it's due to that reason. And one way to prevent it is often if you have consistent readings, you might find a pattern of what's leading to this. Maybe you're having the wrong type of meal beforehand. So these might be some of the issues.
Great. Thank you so much for that. Our next participant has asked, my parents are used to cooking with ghee. Is there any recommendation or substitute I can swap it out with that might be a healthier option?
That's a very good question. So I'm not saying get rid of ghee completely because it does taste good, but again, everything in moderation. But in general terms, if you're going to use oil, for the most part, use a little bit of whatever oil you use, but the preferable one is canola because it has less saturated fat and probably has less risk of heart disease and causing weight gain and so on. So I would say canola oil would be probably the safest one if you're going to use one, but again, even that in moderation.
Great, thank you for that response. Our next participant has asked, I've received questions from people asking if I have diabetes in my family and to be careful. How significant, in your opinion, is genetics, and how much of a risk factor is it for me to develop diabetes living in the South Asian community?
So in terms of absolute risk, we don't really know, but just by being South Asian, it is a much higher risk compared to, for example, the white Caucasians, Southeast Asians, and so on. Unfortunately, you can change genetics, but all South Asians, I would say almost all, not all, but almost all South Asians have a risk for type 2 diabetes mellitus, and you can't change that. So we have to work on the other risk factors, keeping your weight down, living a healthy lifestyle, exercising regularly, being happy, meditation, and doing all the other good things that can delay the risk of or prevent diabetes or delay the risk of type 2 diabetes mellitus. So right now we can't change genetics, but maybe one day we can. But until then, it's all about lifestyle.
Great, thank you for that. Our next participant has asked, are insulin inhalers safe, and are they just as effective? And are they available in Canada?
So inhaled insulin has been studied. The initial ones were actually didn't go through because of concerns about damage to the lungs. So right now we don't have available inhaled insulin on the market. There are studies going on that may actually are ongoing, and one day we may have inhaled insulin. For right now, we don't have any inhaled insulins in Canada, no.
Great. Thank you so much for that clarification. Our next participant is asked, is there a better time of day to exercise, whether it be before a meal, after a meal, or perhaps in the morning?
There's no best time to exercise. The important thing is do it at a time which is good for you and is consistent. Obviously, you want to be careful. If it's minus 40, you don't want to be exercising outside, but without the right attire. But any time is good as long as you keep in mind it's good for you, it's not stressful, and the weather allows you to exercise, whatever it is, whether you bike or you walk. So no, there is no real time. One thing is try not to exercise vigorously with a heavy stomach. That's important because then you might not be able to successfully complete your exercise, and you might feel very nauseous and actually even throw up, which is not a fun thing when you exercise. It's like going on a roller coaster after eating, so you want to be careful that your tummy is not that full. And drink enough fluids when you are exercising vigorously.
Great. Thank you so much for that. So we'll take our last question here. One of our participants has asked, if you are on medications, does one need to be on them forever, even if your blood sugar gets under control?
I never say never. So in general, most people with diabetes need to be on their medications for a long time. Now, as time goes on, sometimes if you make a significant lifestyle change, you might be able to come off some of the medications. But again, that's something you discuss with the doctor. So I would say, yeah, often I cut back on medications on my patients because they lose a lot of weight. New medications come out that are more effective, and they make other lifestyle changes, or they come off a medication that made their blood sugars go high, now they're off it. So it's always a dynamic thing. So I would never say never, but for the most part, it's unusual for a patient with diabetes to come off completely off all medications. But we can reduce medications, reduce doses with time if you make significant changes in your health. So that is definitely a possibility. We do also do that with high blood pressure and many other chronic conditions too.
Great. Thank you so much for that response, Dr. Prapthani. And folks, that does conclude our webinar for today. I'd sincerely like to thank Dr. Prapthani for speaking on behalf of Diabetes Canada. It's been an amazing experience. I do want to remind everyone that our webinar today has been recorded, and it will be made available on our website at www.diabetes.ca in the coming weeks. In addition to some information that Dr. Prapthani provided us with regards to the South Asian chapter, I did want to provide some additional resources for everyone else also on the webinar at this time. If you do have any questions or information, feel free to call our 1-800 number. So that's 1-800-226-8464. We do have some other additional resources at guidelines.diabetes.ca/patient resources. And please be sure to check out our website to learn all about the Diabetes Canada South Asian Expo, which will be held in Toronto in November 2017. Additionally, on the bottom left-hand section of your screen, there is a resource list there. So you'll find a ton of different resources, some in different languages, as well as a bunch of different recipes that whether it's you or your clients might be interested in. So feel free to download those and distribute them as needed. I do want to let everybody know that we have one more webinar coming up for this cultural series, and that'll be held next week on April the 12th, and it'll be on living well with diabetes from an Aboriginal perspective. Thereafter, our next series of webinars will begin on May the 24th with a focus on healthy living. So please be sure to check out our website to register for those. And for those of you, again, as I mentioned earlier, looking for some more support and resources, please feel free to call us at 1-800-BANTING. We thank everybody for joining us today, and we hope you've enjoyed learning with Diabetes Canada, and we look forward to your participation in the future. Thank you.